In my view, the reality is the kids with ferocious parents do better. It's a sad truth that I think, unfortunately, the obstacles to getting appropriate education and treatment are so high. Insurance, dealing with the medical community, getting a proper diagnosis, and the barriers internally, as Beatrice pointed out, denial, fear. Those barriers are so huge that for kids who don't have ferocious parents, the school systems and the medical professionals aren't necessarily able to pick up the pieces. So that's another complicating factor.
Anna, who comes to the side of families that don't know how to work the system, that don't know who to call, that don't have contacts and people that they know can push things along for them?
Well, in the public schools, I think a lot of teachers will help parents and they will refer them. But many of them need advocates or attorneys in order to get the services. So I have seen that over and over again. But it doesn't mean that the public schools don't have the staff or the services that the child needs. It's a matter of really identifying the children early enough so they don't miss that window of opportunity before they age 8 or so. Because if they don't, they're not going to be able to speak as well as they can or to perform different learning tasks as well.
Let's
so anyway.
Talk about some of these families. Mm-hmm. Immigrant families, non-English speaking families, tend, in my experience, to defer to the school. The school is the place with all the knowledge and all the authority. Who am I? So I go to the school, I ask for something, they tell me no. Culturally, and often the experience back in the home country was, well, that's it. I asked, they told me no. How do we get out of that?
I think parents need to be educated, and the schools should really have education meetings so that the parents know what to do. It shouldn't just be up to one parent. It should be that the school is educating the parents on how to access special education.
But don't parents also have to learn how to not take no for an answer?
Sure. And a lot of them insist, but they don't know what to do. They don't speak English. So that's a huge barrier. So I become an advocate sometimes for them because I see that the child needs help. The teacher becomes an advocate usually too because they cannot teach the child. They're very frustrated that the child is not learning and that they have to give them a lot of individual attention away from the rest of the class. So this has been my experience, but I think Hispanic parents really need to become more educated. Whether the school can provide that or the community services, it's very important, not just about autism, about anything, learning disabilities, how to access the system, and I don't think there's enough of that at all.
Marguerite, are we talking about, most kids in America go to public school.
Correct.
So here we are at a time where public schools are being asked to serve breakfast and lunch to millions of children, provide after-school activity because now most of their parents are working most of the time, provide more physical education, more weeks of testing, more required curriculum. Oh yes, and also diagnose autism and help treat it at the school level. Carrying a heavy load, aren't they?
They are, and we have a dynamic in America that needs to be broken. And the dynamic is that while IDEA is a right, it's an entitlement. Every child has a right to a free and appropriate public education. It's funded at 14%. So what we've set up is the federal...
So 1/7 of what you need to be able to do what it promises is actually being spent.
Correct. And we, as an advocacy organization, are every day on the Hill saying, you've got to change that. Because what happens as we work with states, they have to make up the difference in addition to, as you said, all of their other needs. And so what happens is there's this mandate, and yet the counties and the states are struggling to find funding. Couple that with a 1,300% average increase in the number of students with autism entering the school system. It's a crisis beyond belief, and something has to happen. And what has to happen, frankly, is that autism training needs to be done to support these school systems, because while it's true currently in the system that parents have to become advocates, that outrages us. Parents should be parents, and the systems should get the training and the funding needed to roll this out. The good news is it does not cost that much to effectively train a special education team in a school district. The costs are very low. The training is there and available. It's just not being accessed because of the crisis.
Wait a minute.
Yes.
1,300%
on
increase?
average, yes.
Is that because we now know what to look for and more kids who should have been diagnosed in another time are now being diagnosed, or is there a net rise in the number of children who are coming to school with these problems?
We now have conclusive evidence from the CDC of the U.S. government that it is both. Certainly, there's better assessments and better diagnostics, and that has risen in the last 10 years, and that's great news. But the last CDC report revealed that there is a percentage of children out there, 8 years old was the study, that they cannot account for better diagnosis, or that sort of thing. So it is growing.